Welcome back to our lovely webinar Wednesday series. I am Allison Beasley and I am our coordinator of parent and family programs here at UA, and I am going to turn it right on over to our lovely guest today who is going to talk about the Student Health Center and Pharmacy.
Thank you, Allison, and welcome to the introduction to the Student Health Center and Pharmacy, your student's medical home away from home. I'm Margaret Garner, the Executive Director, and I'm pleased to share with you a lot of facts about what you can expect and your student can expect when they need to make a visit to our center. We have a team of 65 full-time staff members whose goal is to be the medical home away from home for your student. You can be assured that the care provided here is at an exceptional level. The Student Health Center and Pharmacy has been accredited by the prestigious Accreditation Association for Ambulatory Healthcare Facilities since 1995. This is the agency that accredits freestanding surgical centers. We are very proud to be among one of approximately 200 student health centers around the country who have achieved this level of accreditation and external review. It's important to know what your student needs to know for their first visit. We are located at 750 Peter Bryce Boulevard. Your students will know that this is adjacent to the university's Recreation Center tennis courts. The bus routes include both blue and green routes that will pick them up and bring them right outside our door. And the bronze route is yet another route that's located just across the street. We are open among the greatest number of hours of any SEC school. So I'm proud to say our accessibility is from 8 a.m. to 8 p.m. Monday through Thursdays and 9 a.m. to 5 p.m. on Fridays. And yes, we are also open on Saturdays and Sundays from 1 to 4 p.m., except for those all-inclusive game days when we have about 120,000 visits to campus. But we are open the Sunday after every home football game. We encourage our students to arrive 30 minutes early for their appointments when it is their first visit to have necessary paperwork completed. We offer walk-in visits as well as call-in appointments, and for certain appointments, they can be made online. We do bill insurance, and since we have students from every state in the United States and 70 countries, we deal with about 400 different insurance plans. Very likely yours is one of those. So when walking in, we encourage students to come as early as possible because our busiest times tend to be late mornings, 11 a.m. till about 3 o'clock in the afternoon. So we can see in these busy months of the academic year 220 to 300 plus students a day. So calling ahead is a great way to secure a time frame with a call-in appointment or an appointment through our patient portal. Our clinical services include primary care services, much like your student would be accustomed to at home. In addition, immunizations, including travel consultations, because a lot of our students from time to time travel for courses or for serving away. We provide a number of different physicals for professional schools. And when we can't provide what your student needs, we have excellent relationships with local specialists and 2 full-time nurses who make those appointments and follow up for 360-degree communication with those referrals. There are certain types of appointments that need to be made only through a call-in appointment. And that's for our women's services, where we have a women's health nurse practitioner as well as a full-time gynecologist. Our nutrition services with a registered dietitian are appointment-only services. And for those students who have ongoing allergy treatment and injections, those are by appointments and can be made into rotating appointments for those that are on a weekly or bi-weekly basis. Our last specialty service is psychiatry, and those are by referral and appointment only as well. So as you can see, our clinical services are extensive and designed to meet the vast number of needs your student would have while away from home. As if that were not enough, we have an on-site pharmacy. So we can fill their prescriptions from our clinic, as well as those that are maintenance medications that can be transferred from home. We provide refills and an easy way to schedule those refills through our UA Pharmacy app. We bill insurance, so there's no need for cash. Any copays would go directly to the student's account. If you have a flex card that goes with your pharmacy services, we take most of those as well. We are very proud of the quick service for our pharmacy services, and most can be provided within 15 minutes wait time. What do you need? You always need that student act card and your insurance card, as well as a flex card for either the clinical services or the pharmacy services that may be related to your specific insurance plan. Again, those over-the-counter products that we have are charged directly to their student account. So once again, they do not need cash when they come to the Student Health Center. UA has a policy for immunizations, and by this time, your student should have provided proof of those. The immunizations that are required is a meningitis vaccine for all entering students who are younger than 21 years of age, or any age if they are living on campus. And this vaccine must have been received at age 16 or older. If our students, and most of them are, of course, born after 1956, then proof of 2 measles vaccines, and one of these must be an MMR. Students can upload their their immunizations through their MyBama account. So they will no longer have to submit paper that can be misplaced. Any of that, we are totally electronic. So they do this through their MyBama account. And I'm sure those of you listening, your students are already up to date, and we have that on file, and they are ready to go. Now, should you have someone that has not already done that, your student won't be able to register for classes for next semester. So make sure that your student is one of our best and brightest who've already done that. All right, the patient portal. We are very proud of the patient portal with our electronic medical records system. It is very student friendly, and here are the things that your student can do. Schedule most of your appointments. Again, I've mentioned those that have to be a call-in or a follow-up at the time of the visit: psychiatry, immunizations, and nutrition and women's health. They can also request refills on their prescriptions, and they can send and receive secure messages with their provider. And now they can upload their insurance card. Very friendly. You may know that the university has a relationship with United Healthcare for a university-sponsored health insurance for those who are no longer on their family insurance. This is an incredibly good buy. Like many insurances that have a deductible, there is no deductible for your student if they remember that the relationship is with the University of Alabama Student Health Center at 0 deductible. If at times when the university is closed and therefore the Student Health Center is closed, they can be seen right next door at the University Medical Center with no deductible as well. and they have reduced pharmacy copays. This is an incredibly good buy for those students who may not still be on their home family insurance or have aged out of your family insurance. Alpha Point is the online prevention alcohol education program required of all entering students. This is because there is a nationwide concern about unsafe use of alcohol and other substances. So we join one of over 500 colleges and universities around the country that use some form of required online training education. This new program began this year. It includes 5 modules that address the balance between alcohol and other drugs and decision-making in college, wellness and mental health, healthy relationships and interpersonal violence, and diversity and inclusion. Your students should have already completed this, and if not, urge them to do so that they are not facing a hold on their registration for next semester. The last leg of the Student Health Center and Pharmacy is our Department of Health Promotion and Wellness. In this department, we have 3 full-time professional health educators, 1 registered dietitian, and they lead 7 strategic health teams in areas that are known to be health-related concerns of the college age in the United States. In addition, I'm going to share with you our award-winning Project Health peer education programs in just a moment. But let me tell you what those strategic health teams are. 1 is alcohol and other drugs, obviously, tobacco education, a 2nd, eating disorders, nutrition, financial health and debt management, mental health, and sexual health and healthy relationships. These 7 areas are incorporated throughout the year to provide evidence-based education and information to guide our students to healthy decision-making. These teams are made up of our health educators and professional staff from all of the divisions of the University of Alabama to deliberate on best ways that we can inform our students on topics known to be important to the college age. Those 7 areas drive the topics that are covered by our Project Health and Gamma. These are the programs under our peer education program that you see on the slide. The first one is the Health Hut. This is a movable gazebo that is attractive to students. It moves every week to different places around campus, and it is on campus providing peer education about 50 to 55 hours every single week. All of the students that work with us with our peer education programs are trained by our professional educators and registered dietitian. The topics that they address throughout the academic year change every single week. And they are provided games and interactive exercises to help assure that they are learning the topics that have been chosen. The second one is our health ambassadors. Our health ambassadors are those that are trained to provide prevention-oriented education discussions in the residence halls, around campus, or to provide a presentation to a classroom. They provide organizational presentations as well. The health advocates are those that are trained to do spontaneous sort of elevator type topics. They'll go into the dining halls, they'll go all over campus and just engage a group of students in the topic of the week. These are fun and engaging with students. Our last one, the Gamma, is the Greek-specific outreach for peer education. They go into their own respective Greek organizations and provide presentations and informal interactions as part of their group's meeting every week. There are many other activities throughout the week that are led by our professional educators. We have wellness weeks. We have student health fairs in the fall and the spring. We engage students in Get On Board Day for understanding the resources on campus. We are an advocate for all of the health-related and prevention-oriented activities that a student could select and provide benefit from over the course of the academic year. This is an extremely important part of what we do. So I hope from this standpoint, you can see that the Student Health Center and Pharmacy is more than providing medical care. It is providing health education not only for the reasons that they come in to be seen at the health center, and supporting them with their medication should they be needed. We have a moderate complexity lab and x-ray right in the same building. And then, if that was not enough, we see our responsibility to providing prevention-oriented health education that maximizes their health and well-being during their academic year so that they can be as academically successful as possible. So let's take a look at some frequently asked questions just to lay some concerns at rest. And the first is, who is seeing my student? We have experienced physicians and nurse practitioners who practice responsible medicine. And moms and dads, here's what that means. We don't believe in giving a pill for everything if a pill is not indicated. The reason in America today that we have medication-resistant bacteria is because of the overuse of medications. So we practice responsible medicine. If we tell your student that it's early on, it does not appear to be something that requires medication now, but if your situation gets worse, you need to come back in 2 to 3 days. That is part of educating our students to be wise consumers of medical care now and in the future. We have flexible hours, the most flexible of any in the SEC. I mentioned to you earlier, 8 to 8 Monday through Thursday, 9 to 5 on Fridays, and 1 to 4 on Saturdays and Sundays, except for home football game days. We do encourage students to come early and make an appointment for faster service. Between 11 and 2 or 3 o'clock in the afternoons, those are our busiest hours. So coming before then or after then is really preferable. The next thing is, if you call and we're busy, leave a message, but remind your student to speak clearly so that we can understand their name, their campus-wide ID, and a phone number to call them back. That is one of the most frustrating things because we want to call back, so we need to be able to hear that clearly. The last thing is that people frequently ask, how are we charged for visits? It works the same as your insurance did in your home community. What is covered for your clinic visits and your prescription is based on your individual insurance plan. If there are differences, we have a wonderful billing office and insurance staff that can help decipher anything that is unique about your insurance plan. In addition, you can transfer your prescription very quickly to our in-house pharmacy. And once again, using our in-house pharmacy, we are committed to educating your student to the responsible use of medications. So that concludes my conversation with you today. I hope you've picked up some tips and information that will help you understand the commitment of the University of Alabama to serving your students' medical needs away from home. Should your student, and we hope not, but should your student need care beyond what we provide at the Student Health Center, we have phenomenal relationships with subspecialists in the community here, and we can make that referral quickly and assure that we will send them the information they need, receive it, and that informs the follow-up at our clinic. We're so glad that you and your student chose the University of Alabama for their academic career, and we are committed at the Student Health Center and Pharmacy to providing the best medical care away from home that they can get. Thank you. Oh, you know what? Moms and dads, I can't believe I forgot this. We've got an active flu clinic going on right now. If your student has not gotten his or her flu shot, they need to look online and do that. We are already, moms and dads, we are already seeing flu diagnoses at the clinic, both type A and B. So it's completely free. There are multiple sites all around campus. It is advertised on our website. So make sure your student is one of those that gets their flu shot early. Thank you once again for choosing the University of Alabama and the Student Health Center and Pharmacy for your child's services. Roll Tide.
Thank you so much, Margaret. We're so excited to be back next week with another episode of Webinar Wednesday, and we are so excited to share today on making the most of the Student Health Center and Pharmacy, and we look forward to seeing you next week.